Senator Scott's bill. I want to make a few different points. First of all, I don't believe this administration or people that support the mandates are really thinking the process through to how devastating these mandates are going to be on our economy. Well before the president even announced his unlawful regulatory initiative, I was hearing from truck drivers, I was hearing from nurses and doctors who've already had COVID, who have natural immunity, who are looking at, for example, the VAERS reports, are looking at some of the data and science saying that natural immunity is 13 to 27 times more effective than the vaccine. And they had chosen not to get it. Senator Scott indicated President Biden promised the American public he wouldn't mandate this. He said, I don't think it should be mandatory. I wouldn't demand it be mandatory. His press secretary, Jen Psaki, said, it is not the federal government's role. I agree. The president also said, this is not about freedom or personal choice. No, Mr. President, this is exactly about freedom and personal choice. I have written so many oversight letters to the healthcare agencies. I completely agree with Senator Scott. I was a big supporter of Operation Warp Speed. I've gotten every vaccine until this one because I've had COVID. But the federal agencies have not been transparent. They have not given the American public information that we need to make that informed choice. We need to recognize people's health autonomy. This is their body. They should be able to make these choices. I want to talk a little bit about some of the information we're not getting from our healthcare industries, our healthcare agencies, that people who are choosing not to get vaccinated are looking at. And it's not disinformation. This is real information. It's just being withheld from the public by our healthcare agencies, by the media, and the social media. The first thing I want to show is a chart I put together. Again, this is real data. This comes from the CDC in terms of the number of new cases per day, as well as the number of deaths per day. The deaths are down here in a very thin red line. But you can see by this chart that in terms of the surge of the initial Alpha variant of COVID, pretty well peaked late December, early January. The vaccines got the emergency use authorization about mid-December. The orange line shows the percent of Americans vaccinated, fully vaccinated. And you can see the initial surge, the initial pandemic was winding down before the vaccines even could take effect. Now, again, we all hoped and prayed that the vaccine would be 100% effective and 100% safe. But when you look at this chart, as the pandemic's winding down, the percent of fully vaccinated individuals are going up, you would think what you'd see is just a complete winding down of the pandemic. But that's not what we've seen. We've seen this new surge of a variant called Delta. So what are we to make of this? Again, I'm not a doctor, I'm not a medical researcher, but I look at this and I'm going, well, it certainly doesn't look like the vaccine has been particularly effective against the Delta variant. But let's look at some data, the type of data that we're not getting from our healthcare agencies, so we have to look, unfortunately, to England and to Israel that are more transparent. Now, I don't expect anybody to be able to read the figures here. I'll give you the highlights, but I'm showing that this is from Public Health England. This is one of their federal healthcare agencies. This is from their technical briefing number 23, dated September 17, 2021. It covers cases for about 7.5 months, from the beginning of February to February 12th. What the data shows is that during that 7.5-month period in England, there were about 750,000 new COVID cases. About a little under 600,000 of those were the Delta variant, about 80%. The number of deaths associated with those 600,000 Delta cases was 2,542, which which gives us a case fatality ratio of about 0.4. Now again, case fatality is higher than infection fatality because these are actually registered cases and there are all kinds of infections that never get registered. So to put this in context, an infection fatality rate for a bad flu season is slightly under 0.2, half of this. Just going to put things in perspective. Now, President Biden, and this has been parroted by media, news media, said that what we are currently experiencing is a pandemic of the unvaccinated. They don't give us really any data to back that up. They just to pronounce that 99% of people with COVID now are unvaccinated, but they don't give us the data. But we have data from England, and here's the data. So of the 600,000 cases in England, 43% were with the unvaxxed, 27% were with the fully vaxxed, another 30% were with partially vaxxed or just undetermined. But I think what's interesting, because here's another quote from President Biden. President Biden said, if you're vaccinated, you're not going to be hospitalized. You're not going to an ICU unit. You're not going to die. You're not going to get COVID if you have these vaccinations. Well, maybe that's true in the US. I kind of doubt it, because in England, of the 600,000 new cases of Delta, of the over 2,500 deaths, 63% of those deaths, 1,613 people were the fully vaccinated. 28% were with the unvaxxed. Now, this is information the American people have probably never heard. It's information, by conveying it, I will get attacked, I will be vilified, I will be censored, I will be suppressed. It's one of the reasons I'm coming to the floor of the Senate, to reveal this information that the American people need to know. Let me close with something else that certainly nurses know, nurses who were our heroes. They had the courage and compassion to treat COVID patients. Many got infected. Some tragically died. Most survived. Now many of those nurses are treating the vaccine injured. Let me just quick quote a couple figures from the CDC's own safety early surveillance system, the VAERS report, the Vaccine Adverse Event Reporting System. Worldwide, from a couple weeks ago, these numbers are pretty fresh, there have been over 15,000 deaths reported on VAERS. Now, I realize VAERS does not prove causation, but of those 15,000 deaths, over 5,000 of those deaths have occurred on days 0, 1, or 2 following vaccination. Now, again, it doesn't prove causation, but if I were working the CDC, I'd be looking at that very closely and analyzing those cases. The final number, total adverse events on the VAERS system in 10 months since the COVID vaccines have been under emergency use authorization, over 725,000 adverse events. So again, I was hoping and praying this vaccine was 100% effective, 100% safe, but that does not appear to be the case. And I believe this administration, I believe our healthcare agencies need to be honest and transparent with the public. They have not been. The American people have the right to choose. It should not be mandated. We should respect their personal choice. We should respect their freedom. And I'll just close on, I will be bringing more information as we discuss other ways to push back on these mandates over the next few days. So stay tuned. I yield the floor.
Mr. President.
Senator from Utah.
During this pandemic,